Hello, my name is Dr. Faraz Ahmad. Everyone who is going to appear in the PLAB 2 exam must be knowing that your PLAB 2 station are assessed on the basis of your history, on the basis of your management skills, on the basis of your IPS, and all of the three domains contain equal marks. That's mean 4 marks for the history, 4 marks for the management, and 4 marks for the IPS. But what happened in the real exam? Like when results come, the most of the people complain that, oh, I scored only 25 marks in the management and I scored 45 in the history. The reason is this: because a specific type of notes are available to every student, and these notes are available online, and everyone is reading those notes blindly, and almost everyone is going to follow the template of those notes in the exam. And what happened that when there is 6-minute bell, people are still taking the history. So as I mentioned that there are equal marks for the history and equal marks for the management, and your IPS is part of the both history and the management. But mostly IPS is focused on the management part, because in the history you are asking the direct questions. So what happened when you are taking 6-minute history and you are just giving 2 minutes to the management and the IPS part? This is the reason you got failed. So in this video I will tell you about the steps of the management, and after following these steps of the management you can get very good marks in the management as well. But the key is that you have to practice in a way like you are taking the history in 4 minutes and you are going to give complete 4 minutes to the management part of your case. So I will tell you about the steps of the management. You have to talk about all these steps in the management of any of the case. So first of all, you will explain the diagnosis to your patient, and the second step is this: you will talk about either we are going to admit you or we are going to refer you. Third point is this, that you will talk about that I am going to involve my senior, and the fourth point is this: you will talk about the investigation or the blood test, and the fifth point is this: you will talk about the symptomatic treatment and the lifestyle management. If the case is acute, then you will only talk about the symptomatic treatment, and then you will talk about the specialist management, like you will involve the specialist who will treat you, like you can involve any of the specialist, cardiologist, endocrinologist, or anyone depending upon the case. And then seventh step is this: you will talk about the follow-up, and then in the eighth step you will talk about the safety netting, and the end you will give your patient to the sport. Now I will tell you that how you can complete these 9 steps in just 4 minutes. So like, first of all, you have to tell the diagnosis to your patient. You have taken the history and you have done the examination. Now you are going to tell the diagnosis to your patient. Now you will say, Mr. James, as you presented to me, because you were having the pain in your lower tummy, and you mentioned that it was associated with the vomiting as well. And at the same time you mentioned that there was some burning in your micturition as well. Then you will ask, am I right? Patient will say yes. Mr. James, and then I examined your tummy and I felt that there was tenderness in your tummy, and during the observation I have noticed that your temperature was on the higher side. So from these findings I am suspecting that you are having a condition which is called appendicitis. So if you are going to explain the diagnosis in this way, there is no need to ask the patient, have you ever heard about it? There is no need to ask about it, because you have explained the situation depending upon the signs and symptoms of the patient. So now you have explained the diagnosis to the patient, and now you will talk about the admission. Now you will say, now we are going to admit you in our ward, and I am going to involve my senior to make sure that I am not missing something. And then you will say that we will run some of the blood tests as well to confirm the final diagnosis, like the routine blood test and the infection markers as well. And then you will say that we will run some further investigations as well, including the scans like ultrasound of your tummy. You can explain in this way. So after this you will say, you can involve the patient in between. Are you following me? Are you on the same page? Are you comfortable about my advices? You can ask your patient in the same way. Then we will move toward the symptomatic treatment and the lifestyle measures option. As this is the acute case, we will just talk about the symptomatic treatment. You will say that now I will give you a painkiller, and we will give you the paracetamol through your blood vessels as well, and at the same time I am going to give you the antibiotics as well. Then you will say, I am going to involve one of the specialist doctor from the surgical team who will come and they will assess you and they will talk about the specific treatment of this condition. Do you want to hear about the specific treatment? If patient want to hear about the specific treatment, you will explain that they will do the surgery to remove your appendix. The next step, we will talk about the follow-up of the patient. We will say that after the discharge from the hospital, you have to follow your doctor back as per the recommendations given by your doctor. So at the end, the eighth step is this: we will have to talk about the safety netting. Please make sure that you have to safety net your patient, either your patient is admitted in the hospital or not. Some people ask that we have not to safety net the patient if patient is admitted in the hospital. No, you have to safety net your patient if your patient is admitted or not. Like you have to safety net for two things: safety net for the presenting complaint and safety net for the complication. Like for example, if your patient presented with a chest pain and it was a heart attack, you will safety net, Mr. James, unfortunately, if you develop similar type of the symptom, like similar type of the pain, and if you develop complication of the heart attack is the heart failure, like if you develop severe shortness of breath on the lying down, if you develop any swelling of the feet, hands, and the swelling of the face, please call us. We are always here to help you. And the last step, please never ever try to forget to offer the support to your patient. Like in this situation, patient presented with appendicitis, this is an acute case, your support is different, and if some patient presented with a chronic condition, support will be the different. Like in the acute condition, how you will support your patient, you will say, Mr. James, at any time if you need some clarification, if you want to ask something, my name is Dr. Faraz Ahmad and I am present here till 12 p.m. or I am present here till 12 a.m. You can call me. I will be more than happy to help you. This is the support in the acute condition. And in the chronic condition, how you will offer the support to your patient, as I mentioned in the history, like in the chronic condition, you will ask about like how this condition is affecting your social life and your occupation. Patient will tell you about the social life and the occupation. So depending upon the history, you will offer the support. You will say like, Mr. James, I am going to refer you to one of my colleagues from the psychiatry team. They will talk to you and they will tell you different ways to deal this condition. So definitely this will help you in fighting with your problem. So this is a support you have offered to your patient in the chronic condition. So these are the steps. You can easily follow these steps in 4 minutes. So if you are going to follow these steps in the management, definitely be assured that you are going to get complete 4 marks. So if you are taking the history in the 4 minutes and you are doing the management in the 4 minutes, definitely you will pass your station. The main thing of failure is that like people take history 6 minutes and they do management just in the 2 minutes, and during the 2 minutes they forget to mention a lot of the things. This is the reason they got failed. So please follow this strategy and I'm pretty sure that you will pass. Thank you very much.